Hello, live from ACR 2024, I'm Laura Stradford, Associate Director of Patient-Centered Research and Epidemiology at the Global Healthy Living Foundation, and today I will be discussing the WARE study with Dr. Jeffrey Curtis. Dr. Curtis is Professor of Rheumatology at the University of Alabama at Birmingham and Chief Medical Informatics Officer at Illumination Health, and the co-principal investigator on this study. With wearable devices such as Fitbits and Apple Watches so prevalent, we wanted to know how this type of device could help monitor patient health in between healthcare visits. For the WARE study, we combined 3 streams of data: patient-reported outcomes, Fitbit wearable data, and clinical data in an attempt to create a whole picture of the patient experience of living with rheumatoid arthritis. Research is currently limited on how different remote and passive measures of patient health can promote discussion between patients and their healthcare teams. This abstract looked at what Fitbit data adds to patient-reported outcomes to better predict a decrease in disease activity as defined by a lower CDAI score. How do you feel looking at the different types of data that we collected in the WARE study?
It's great to have different kinds of data because different data sources complement one another. Patients can tell you how they're doing, how they're feeling, but sometimes even if they self-report, for example, activity levels, they may not remember that they're getting small forms of exercise throughout the day. So I think as a more holistic picture of how people are sleeping, how much activity that they're getting, it's great to have both passive data from a biosensor device as well as actively reported data where they answer questions to let providers know how they're doing.
How do you feel different remote methods of tracking patients helps physicians and patients have better discussions about their treatment?
I think physicians often have very little idea how their patients are really doing. You know, if you come see a rheumatology provider like me 4 times a year, that's great, but I'm essentially sampling from your life. And I think it's critical to know, how are you doing the 360 or so days a year that you are not coming to see your rheumatologist? So having data out of the office, whether from a smartphone app or through a biosensor device that you could wear, provides a more complete picture to providers for lots of things that happen that patients may not remember from visit to visit. You know, they had to take a break because they had a flare and they couldn't do much for a week or 2. But if that was 2 months ago, they might not remember. But having out-of-office data like we collected in the WARE study fills in those important gaps.
We've had the pleasure of working with you on many different projects at Global Healthy Living Foundation. Can you talk about your favorite or most meaningful collaboration with us?
So I had to give it some thought, and at last count, I think it was close to 80 or so projects in the decade or so history we've been doing research projects together. I think probably the most memorable is the one that Kelly Gavigan led that I was part of, that asked patients about who was it that was prompting changes in their rheumatoid arthritis treatments. And what we found is that mostly patients were satisfied with the status quo or deferred to their provider to make treatment recommendations or changes. And to me, this is both important but a bit of a disappointment, because I want patients to want better for themselves and not wait for their doctor to recommend treatment changes. So I think it's still among the most important studies that GHLF has done, and certainly that I've been part of, because it speaks to goal setting for patients. And it's great to be doing better on whatever treatment you're on for arthritis, but it's even more important that patients are feeling well. And I don't want them to have disease that's smoldering along, waiting for their doctor to do something. I'm delighted when they're proactive, thinking, you know, am I in remission, or am I at least in low disease activity? And in that study, we found a lot of patients weren't, and yet were deferring to their provider to want to do anything about it. So I think the actionability of that study is still relevant today and forms a future research agenda for things we could do together.
Thank you so much.
Thank you.